Hi everyone, welcome to LaserAway Live. It's me again, Corey, one of the nurses here at LaserAway, and I've got my beautiful model here, Emily. Thanks for coming in.
Hi, thanks for having me.
By the way, happy International Women's Day.
Thank you.
You're so welcome. Girl power.
Yes.
Yes.
This was one of the ways, I feel like this is a great day to remind yourself to do a little self-care.
Absolutely.
And so this is one of the ways.
This is your
I like
self-care.
Yeah, so I'm treating myself.
We're gonna do Xeomin today on you for this day. We're gonna celebrate you, and we're gonna take away your wrinkles. What better way to celebrate being a woman. So we are going to do neuromodulators today. We offer Botox and Xeomin here at LaserAway. And to explain a little bit more about the differences and the similarities, we're going to take it to our Chief Medical Director, Dr. Kirby, who explains this really, really well. So take it away, Dr. Kirby. We'll see you back here in a second.
Neuromodulator refers to an injectable substance used in aesthetic dermatology practices that relaxes the skin. The way it works specifically is it prevents communication between nerves and muscles. And when those muscles can't move, wrinkles relax, giving a more youthful appearance. The neuromodulator that you have probably heard the most about is called Botox. But just like Xerox and copiers or Kleenex and facial tissues, these are branded names, and there's multiple competitors within the category. Here at LaserAway, we offer two types of neuromodulators, Botox and Xeomin. Botox and Xeomin are astonishingly similar. They have the same core toxin, they're reconstituted the exact same way, they're injected the exact same way, they feel the exact same way, and they have the same length of duration, meaning they both last the same amount of time. Now, when patients get either Botox or Xeomin, they get the exact same clinical result too, as you might have guessed, meaning that their wrinkles are decreased and they have a more youthful appearance equally with both Botox or Xeomin.
All right, so there you have it, Botox and Xeomin. They're both neuromodulators. We offer both of them here at LaserAway, and they're the same thing. And I'm gonna do it on you today, so you guys can take a look and watch, and you'll just see that it's the same process as Botox.
Okay.
So do you have any questions before we get started?
Well, so I've done the Botox, and I know dosage-wise what I like.
Exactly.
So is it the same amount you're putting in?
It's literally the exact same. So I'm just gonna be following what we did before, and I'm gonna put the same amount of units in and the same number of injection sites. So it's totally the same. And you'll feel it kind of start to work in a couple of days, just like your Botox.
Okay.
And then it's going to peak in 2 weeks, just like your Botox.
Okay.
So, and you'll have, the whole thing about neuromodulators is that it's going to relax your muscle. Mm-hmm. So that in turn is going to relax your wrinkles here. So it'll be the same effect. They're both neurotoxins and they react the exact same way. So
then what's the benefit of Xeomin?
Good question. So we like to give our patients choices. And some people are just really familiar with Botox and the name Botox, and they just are more comfortable with that. But Xeomin, being the exact same thing, is actually just a little bit less expensive for our patients. So we love giving them a little bit less expensive option.
Okay. I like that.
If you're not honed in on that Botox name, then you have the choice between the two. So
let's do it.
Yeah, let's do it. And we've actually done a couple of split face tests with this, just to kind of prove that patients who are used to one or the other will literally split their face down the middle, Botox on one side, Xeomin on the other side, and they cannot tell. We don't tell them which side is which, and they have no idea. So this is really the same thing. Yeah. Cool. Okay, so when you're ready, I'm going to have you put your face back. You don't have to put the headband on. You can just kind of move your hair out of the way. And this is what the treatment would look like. And Emily was kind of saying that she likes a certain amount of Botox. She's an actress here in LA. So that facial movement is really important for her. She has to be able to still make some expression. So we do kind of a baby Botox on Emily. We don't go super strong. And she's also a female who doesn't have super strong musculature in the first place. So both the neuromodulators, Xeomin and Botox, are able to be catered to the different person and kind of what they want and based on what their musculature looks like. So we can have you come on in and take a look at your different expressions and kind of cater this to each person.
Yeah, I like that I can just do a little bit.
It's a little less scary, right?
Well, because it makes a difference. It really does. I can tell that I feel younger and my skin's in better shape, but I don't feel like I'm losing any of my expressiveness. So that's good.
Good, perfect. And I'm actually going to have you take a look in the mirror just real quick. So let's make sure we're on the same page here.
Okay.
So I want you to make a really angry face. I know it's hard for you to do.
I know.
So you've got a little set of muscles right in here, procerus and corrugators. And when you make that face, they are depressing in and giving you those 11 lines. So by injecting some neuromodulator right here, we're going to soften that up. So you can still kind of make, you know, that type of face, but this will be really soft in here.
Okay.
And then get really surprised. Perfect. So all of your neuromodulator is completely worn off at this point.
Yeah.
It's been like, it was last year. Sometimes it's been a while. So you're definitely due. And we're going to do some little injections up in here so that when you do make that face and kind of arch your eyebrow up, it'll just soften all of this in there. So it'll be nice and smooth.
But I can still like raise my eyebrows.
Exactly. Yeah. You won't be like frozen where you can't make that movement, but it'll just soften everything and make you look much younger. And yeah, you're going to look amazing.
Yay.
Perfect. So we're going to start with that glabella complex. And again, I've drawn this up the exact same way I would Botox. It's the exact same amount, and I'm going to inject it the exact same amount. Okay?
Okay.
So look over towards me. Good. And make that angry face. Beautiful. All right. And then you can relax your face. Good. So you're going to feel a little poke here on 3. 1, 2, and poke. Beautiful. And done. How was that?
Easy peasy.
Good, good. And you're used to it now, so it's really easy for you. Get angry again for me. Good. Relax. Beautiful. 1, 2, and 3. A little pressure. Awesome.
It's just that crunch.
I know. So we are kind of breaking through, you know, some muscle fiber, so you kind of feel a little bit of a crunch there. And just stay relaxed. 1, 2, and 3. Great job. Awesome. And then I'm going to walk around to the other side to get those other 2 injections on that other corrugator. Take this microphone with me. All right, perfect. And angry for me, relax. Good job. 1, 2, and poke. Great job. We've got one more and then you'll be all done. Stay relaxed for me. 1, 2, and 3. Good job. That is it.
Cool.
Okay, so kind of made that angry face. Good. So this whole complex has been injected with the neuromodulator. It looks the same right now because the medication takes a couple of days to begin working. And then this is going to peak at 2 weeks.
Do I keep
So yeah, I kind of make that angry face a couple of times. Perfect. And a lot of times patients come into us and they say, that they want their forehead done, and what they mean is kind of both of these areas. So again, this is the glabella complex. That's the 11 lines right in the middle, and then the frontalis is up here. So it is 2 separate groups, and we have to inject both areas to include the entire forehead. All right, so now we've got one more area for you. And real quick, you guys, there is a link in the description if you are interested in learning more about neuromodulators. Again, we offer both Botox and Xeomin here at LaserAway. We do free consultations. Click on the link and we can find out which location is closest to you and have you come on in for a free consultation. Ready?
Yeah.
Okay.
Do it.
Really surprised for me and relax. Good job. Little poke. 1, 2, and poke. Good. And you can see Emily is very relaxed and not in too much discomfort, right?
No.
It is a
I mean, it is a prick.
It's a prick.
Some of them I can't really feel and some of them I can feel more.
Okay, good. Okay, then surprise again for me. Good, relax. And little poke. 1, 2, and 3. Gorgeous. One more tiny poke here. Stay relaxed. 1, 2, and 3. Great job. And I'm gonna walk around one more time. We're almost done.
How am I doing? Am I bleeding at all?
No, not much at all. Yeah. There is always a 10% chance of bruising with a neuromodulator because we are putting a needle in the face.
Yeah.
This is a teeny tiny needle, so if you do get a bruise, it will be really, really small. You can cover it up with makeup.
Cool.
Okay, real surprise and relax. Good job. 1, 2, and 3. Perfect. Surprise. Relax. 1, 2, and 3. Stay relaxed. 1, 2, and 3. You're doing so well. We've got one more in the center and then you are done. 1, 2, 3. That's it. Okay, so surprise a couple times in a row. Beautiful. That's it, you guys. It's really, really simple, both for Botox and Xeomin. Again, the main thing is that we're just making sure we get really good coverage with the product. It will spread out a little bit, and they both spread the same way, so they'll both be the same.
Okay.
And yeah, in 2 weeks, she'll have the peak of her results, and then it will gradually start to wear off over the next 3 to 4 months for you.
Awesome.
Yeah.
Sounds good. Thank you so
Do you have any
much.
questions?
No,
We're good. Do you have any auditions today or anything?
I'm going to class where I have to do a scene,
Okay,
so I'm
okay.
happy that I can still do some.
You'll definitely be able to move today, and
Yeah.
the little blebs where the medication is will go down in about 30 minutes.
Yeah.
And then just say it for the next 4 hours, and just don't press really hard on your face for the next couple of hours because it can move the medication
Right.
around. But otherwise, you're good.
Perfect.
Yeah.
Thank you so much.
Thank you. Thanks for coming in. So thank you so much. Again, there's a link in the description. And if you would like to come on in and see us for a free consultation, please come in. We'd love to meet with you and introduce you to neuromodulators, or keep doing neuromodulators if you're doing it somewhere else. We now offer Botox and Xeomin. Thank you so much for watching. Take care. Have a good day.
Bye.
Bye.
Like that video? Make sure to subscribe to our channel by clicking left. And for more awesome videos, click right. And to schedule your free consultation for any of our services, click the on-screen link. What are you waiting for?